Hi there. I'm Li-Lan Wise. I'm a licensed acupuncturist in Durham, North Carolina, and I'm the steward of Armonia Health, and a wellness center where we have Chinese medicine, body work, and courses on both Chinese philosophy as well as movement therapy. And here we have a friend and colleague of many years, and she is offering both in-person private consultations here at Ammonia Health, as well as she offers Restore Your Core, a trademarked 6-week course online currently. So I'll turn it over for her to share more about you.
Yeah, thank you, Li-Lan. Yeah, I'm Natasha McCurley. I feel so grateful to work here with the clients at Armonia. I am a movement teacher, certified in Restore Your Core, and I'm here to help with any pain or discomfort in the sense that I can help you learn more about your body, learn about how you move, and ways that you can move to help you feel better.
Hey, so you know what I really wanted to hear again is how you moved and started this whole journey.
Yeah. So I am also a farmer of about almost coming up on 15 years, and have always been really interested in keeping my body healthy so that I can work and produce food and take care of my family and all of those things. And I, over the years, had pain. Like being human, you have pain sometimes. Back pain or this or that. So I've always been interested in how the position of my body and the way I move can create ease or dis-ease, dysfunction in my body. And when I had my first son 9 years ago, I had severe pelvic pain, so pubic symphysis pain, so at the very center of my pelvis. And it made walking hard. It made just like the pregnancy hard. And I was like, I want to be active. And my pelvis hurt so much. So that's where I started to learn about the pelvis. I feel like it's this really obviously important area of the body that I didn't know anything about. And so I started learning about alignment and learning about movement and how important movement is for the health and the well-being of the different areas of our bodies. And then after my second pregnancy, I just wanted to learn more. I felt so much better in my second pregnancy. Like I didn't have the same issues because I had integrated a lot of things that I had learned into my movement, my daily movement and exercises. And then my second pregnancy didn't have as much, and wanted to really share this information with more people. And so Restore Your Core is an incredible online program that I took, and then I found out that you could get certified to teach it. And so that's how it started. And the beauty of the program is that while it is focused on, we are trained to help people rehabilitate core and pelvic floor dysfunction, it's whole body. So we never isolate one area of the body. We are looking at the body as a whole system. So, everything, the shoulders can affect your pelvic floor, your feet can affect your pelvic floor. All of these things are connected. So, yeah.
And I think your second son is now, what?
5.
Yeah, so it's been, a journey of both self-awareness and self-care and a very holistic approach, which I absolutely love, and that's the way I like to take care of myself, too, and learn.
Yeah.
And so thank you for your introduction. We wanted to share with you kind of a collaboration, co-creation talk here. And because Natasha and I have known each other since before your second son was born.
Yeah.
Right? So.
Yeah, I came to see you for the first time when I was pregnant with Wendell.
Oh, you were?
Yeah.
Okay. That's when. Yeah. Okay.
Yeah, I know. I feel like we've known each other longer.
Yeah.
But really, it was, I think, in that pregnancy. Yeah.
Okay. Because at that time, I was teaching the Arvigo technique self-care massage, so focusing on the abdomen, both from female and male pelvic organs as well as digestive. And it was for the public class of 2.5 days. And I think that's when we first met, I think.
Well, was it with No, it was with the first pregnancy. What am I talking about?
It was with Oscar.
Yeah.
Or something.
Yeah, it was with Oscar. Okay. Yeah.
And I've loved how, Natasha is you've just kept at it at your both learning and then becoming certified, and now you've been teaching now for
almost
2 years. 2 years, yeah. And so I found that when I was both learning about my abdomen as well as like diaphragm and breathing, that the piece that was missing that I had to learn separately a little bit was about the pelvic floor support, particularly for women. And so that led me into more alignment and the posture of my pelvis, because I've traditionally always slouched ever since I was like 4. And then it's taken me into like my early 30s, I think, before I started focusing on my posture and my self-care. And now I'm 42 and I'm still working on my posture. But I used to say I work at like one section each year, like one chakra at a year is how I took it. So I'm fine with like really taking my time with my body. And at the same time, there's so much information that we could share that you can like use right away. Right. So we both, I think, agree on like patience and awareness and embodiment and keep learning.
Yeah, it's a super, I know, it's like I wish I had a magic trick that would make you feel better immediately and for a long time. But I definitely think that the more you learn and the more time you spend getting to know what your body's doing and the things that help it feel good is like the long-term game, the long-term goal. Yeah.
So I thought I'd share for a few minutes a little bit about what I used to teach, and now in group classes, and now I just show more individually. But this work came from studying with Dr. Rosita Arvigo and about the Maya abdominal massage. And what I've taken from there is that since I work with a lot of women's health and women's reproductive health, is that these models that I have, and I'll show you, there's 3. So these 3 sizes, let's see, large, let's put the medium in the middle, small. These are models of the uterus, more or less to size, but this is a uterus before menstruation. It's about 8 ounces. This is a uterus after menstruation. It's about 4 ounces. And then this is a menopausal or perimenopausal uterus where it's just smaller and it shrinks because it doesn't have to go through the cycles every month of hormonal changes. And so part of what happens with any kind of pelvic congestion or things that are inflammatory, for example, fibroids, cysts, uterine cramps, is that there could be a positioning issue. So that means that the uterus could be tilted to one side, to the left, or to the right, to the back, or to the front. And that is more when it's chronically in that state. And the way I've seen is like I used to always lean, I still do, lean to my left pelvis, and so I'll feel a pull that's not equal on the front part of my abdominal muscles. And so the idea is that when that positioning becomes chronic and there's inflammatory issues happening within circulation, then things like cysts, fibroids, uterine cramps may develop. And so that's a piece that I think the modern medical profession, they know actually about the uterine position, but it's not a piece of information that is considered a problem or that causes problems. And so it's not addressed from a structural alignment, massage, or circulatory aspect. And I think that's where we can complement. When you do know that diagnosis, we can provide some other tools. Yeah,
absolutely. Yeah, so like with a one-on-one session with me, what I do is I look at movement patterns and postural patterns. So everybody has imbalances, and they can lead to issues. They can also not lead to issues. So I always want to make sure that people know not to feel freaked out. But what I often see is, some rotation in the ribs or in the pelvis. Oftentimes one side of the hip is higher than the other, which leads you to, shift your ribs or shift your entire hip structure to one side or the other. And that makes so much sense that then that impacts your organs. And so when I work with somebody, we bring that to our awareness, and then we do exercises to bring more balance. And, I love the term dynamic equilibrium, because balance is a steady state, and we're always in motion. So it's really good to have the full range of motion available to us in any direction. And so oftentimes we just need a little bit more movement on one side and sometimes less movement on the other. That's especially something that can come up with the hips.
Yeah, and the SI joint, right?
Exactly.
Posterior SI joint.
Yeah.
There were two things that I love the words you used about, like, being able to access various planes of movement. Is that right? So I see that as like directional.
Yes.
Yeah, like there's vertical, horizontal, and then everything in between.
Exactly.
So all the diagonals.
Yeah, so when we think about movement, we think about, this plane, forward and back, right? This plane to the sides, and then also rotational. So our pelvis, and we've got this nice model here, should be able to move this way, and also to rotate. And it needs so much mobility in relationship to the legs. So sometimes we lack some of the freedom of movement between the pelvis and the legs. Or also it could be very sticky with the spine. And so those are the types of things that I like to work with people on. Because more freedom, I don't say too much freedom, but lots of freedom in all those ranges of motion can often lead to, I never use the word stagnation, but it just makes sense that if you have more movement, then you would have less stagnation, more oxygenation, So.
And also, I think there's some people who they can be overly flexible.
Yes.
And that can also lead to injuries. Right?
Yeah, so that's a big thing that we do, especially with the whole hip complex, is strengthen. And one misunderstanding that is very pervasive is that flexibility, we need more flexibility, and in order to become more flexible, you just stretch. And in the work that I do, you strengthen in order to lengthen. And there's a lot of reasons for this, but our muscles become more mobile as they are stronger, because they're more comfortable knowing that they can lengthen without fear of going too far. Is one way. That's how I think of it. So a lot of what I do, a great example is in the hip flexors. A lot of people complain of pain in the front of their hip, and they think, I just need to stretch. And in fact, when we strengthen the hip flexors, oftentimes people feel a lot more freedom of movement as soon as they do that strengthening. So it's cool.
It's when I used to explain, it's like we all have whatever balance we've been at, right? But we want to broaden our capacity, either of our muscles, right? So it's like, for me, it's like traditionally things have been tight, and so I've worked slowly and over a long period of time of how I can soften and increase flexibility. And thus, I've felt stronger, my muscular is stronger in a certain way, but it went through phases. And then there's, and then we all have different, unique presentations, right? And that's where an individualized sort of consult would be useful.
And I love, that's a great point. And I just think we, particularly as women, depending on your cultural background, because I work with people from a lot of different places, it's like strengthening the exercises that strengthen are sometimes less appealing for whatever reason. And so, I've learned, especially in my own body, seeing a lot of people doing it, that strength-based exercises I'm doing bicep curls, but I don't know how to do biceps. Strength-based exercises are really supportive in mobilizing. So I really like to include those a lot.
Mm-hmm. And sometimes that word strengthen is actually not like crunch, like not tightening, right?
No.
Yeah. And I think we're talking in Spanish that sometimes muscles are weak because they're too tight, right?
Mm-hmm.
Yeah. And so the strengthening is like, I always used to think of like, doing weights.
Yeah.
And I usually got tighter if I did weights because it just,
so it's all about just, that's what I like to help people do, is bring that awareness of what it is that, what imbalance is there. Sometimes, that there's all kinds of different ways you can bring that feeling.
So what I like is sort of visually, since I'm a visual person, it's like we both have a sort of holistic approach where I can see visually how you're focusing on the various parts of your movement and awareness, right? Because you give practical advice, not just like do this stretch. It's like, how do you incorporate it into your daily life, right? And what you also do for a living, like what you do like the most of, right?
Yes,
that you can just like incorporate these practices.
Absolutely, yeah. Integrating movement throughout your day. Any exercises that I give, they can be kind of, I work with some people who have physical jobs, so being sure that they're using a diverse range of movements in order to achieve a goal, right? So not just repetitive movement over and over, and then being sure that they have the range of motion in order to be able to do that. And then, if not, it's just like taking an exercise that I give and being sure that you pepper it throughout the day.
And also people who maybe over-exercise in a certain way and then have injuries.
Yes.
Right?
Yes.
Traditionally, I've treated a lot of people who are like hardcore athletes, but due to age, I think, and sometimes being women, our hormones change over time.
Yeah, and injury, one interesting thing injury does is that our bodies want to compensate. They want to help us to be able to continue to do the thing we're doing. And sometimes that compensation can create a different injury and a different condition. So it's like over time, just learning how to know what your body's doing when it's doing what it's doing is like part of a lot of the teaching that I do. Yeah.
I also like what you brought up a little earlier about like the differences between our left and right side, maybe, and like, I used to always do the same amount of stretches or the same amount of time this side and that side, right? And that's not the most efficient way.
Yeah, and I mean, so again, it's about knowing what you're doing. So if you have a tendency to, hike one hip, I'm much more comfortable with my right hip hiked. And so if I know that, I'm going to be sure that I spend more time with my hips level, or I rotate it. Most people have a little bit of rotation in one direction or another. So being sure that your exercises include rotation in the opposite direction. It doesn't mean don't go in your preferred direction, but it's just like have a lot of awareness that you spend a good amount of time rotating in the other direction. I mean, it's even with dexterity, like if you always step up with your right leg, can you try stepping up first with your left leg? But the only way you can even know to do that is by knowing what you do.
Paying attention.
Yeah, exactly. So that's one of the funnest parts for me, is that like if we come to this work with a lot of curiosity, then it's like you're constantly uncovering new things that you can play around with and change, because our bodies benefit from diversity, like they in all ways, right? Like they do.
Unity through diversity. We're talking about the Earth Path. Unity through diversity.
Exactly. And I mean, isn't that amazing? We're one body made up of all these different parts, and we really need diverse movement. And so, at the same time, our bodies really like efficiency. So sometimes efficiency can lead to overuse and injury. So
And also, for those of you who maybe aren't athletes, have certain restrictions with mobility, Natasha can also work with you because it's very unique to each person. Right? Like I've seen you give patients here breathing techniques for helping with. You want to mention maybe like some of the cases?
Yeah,
you found that breathing techniques.
Yeah, so we talk a lot about in the work that I do. knowing how to breathe into your ribs, so expanding your ribs to when you breathe. And there's a lot of reasons why that's really helpful. One of them is to decrease pressure on the front wall of your abdomen and also decrease pressure downward on your pelvic floor. And the other thing is that we have all these intercostal muscles that are there to move, but some of us are really locked down in our chests. So we just belly breathe. It's possible we're putting a lot of pressure on our pelvic floor and our ribs don't want to move. And so imagine like that could create issues like lung issues, like maybe you want more oxygen and flow in your chest. So we talk a lot and work on 3D breathing, which is a little bit of movement everywhere, but definitely in the rib cage. So front, this is another plane thing. So front and back, side to side, and just a little bit up and down. And that can address lots of different issues.
Right. Because I used to teach like the upper diaphragm. This muscle is like the opposite of the lower diaphragm, the pelvic floor, and then you have our organs all in between, which are cushioned and held and affected.
Yes,
breathing.
Exactly. Yeah, definitely.
That's what I'm gonna come in next for, is because I'm working on my intercostals right now, like my chronic slouching. Now that it's better, but I could tell like when I do a spinal sort of wave, that this section here is like not quite waving. And so I love to get that feedback from you, because I've played with the planes, but I was like, I'm happy to sit down with you to tell me what you notice.
Yeah, absolutely. The thoracic spine, like restore your core, that is one of the regions that my teacher talks about the most. You don't think about your upper back as necessarily being related to your pelvic floor function and health, or your frontal core function and health. But if we have no movement in our upper spines, then especially if we're rounded forward, the pressure, is front and down.
And the tailbone, mine is tucked, forward.
Yeah, exactly. And that we actually have a little bit of extension in our upper spine, most of us, but we have to find it. I remember the first time I felt my upper back go into just a little bit of extension, and and was able to actually find those muscles in order to do it. It's like, I've never intentionally used those muscles before.
And I love hearing, like, these days, like, those cues with words. I guess I've trained myself to, like, pay attention. And so if you find that useful, we can get a lot out of working with Natasha. Thank you.
Yeah, thank you. I'm excited if anybody wants to reach out.
Yep.